Good afternoon. Hello. Thank you for spending your time with me today. I'm Joya Van Der Laan. I know that a lot of patients who registered already know me, but there are a lot of people who registered who I don't know. So it's nice to meet you virtually, and thank you for spending what is maybe your lunch hour with me. I'm just going to wait maybe 30 seconds or so for more people to pile in here. In the meantime, I want to make sure that our Q&A is working. And so if you can see on Zoom, there should be a Q&A or even a chat feature that you can even try out. So to just try it out, you can type in the chat, maybe what joint is bothering you. I'd love to know that even for context while I'm talking, or where you're from, what city you live in. Okay, so let me share my screen really quickly. I am a visual person, and so I always like to have some slides, and bear with me because I am a medical provider, not a technological genius. So let me share my screen here. So here are our slides. So again, this is a webinar on how your body can heal itself when you give it the right tools. So this is going to be a webinar about the science and about questions that I get a lot that I'm sure you have about this and about how this all works, because there's a lot of misconceptions out there about what is stem cell therapy, what is regenerative therapy. And so we're going to clear all that up today. So here's what we'll cover. Why I started doing this. A lot of it is because I had issues, and I'll describe those a little bit. And then this hidden repair system that we have in our body that we can turn on and can activate as long as we're doing the right things. And a lot of that is regenerative medicine. And then what are some conventional treatments that are options for your arthritis and that kind of thing? So we always want to have options when we're deciding on medical treatments. And then what is the science of regenerative medicine? So we'll learn a little bit there. I will address some concerns. I hear a lot of concerns about this and valid concerns. So I want to address those and make sure that I'm giving you the right information. You have the right information before you're making a decision. And then what makes Nourish House Calls different and next steps if you want to pursue this regenerative treatment. So what happened? Why did I get into this? So I'm a family nurse practitioner. I've been a family nurse practitioner since 2011. And I started off in pain management, actually. And so was giving injections of things like steroids. So I'm very familiar with the whole pain management space and the prescriptions that we used and yeah, the injection techniques and other things that we used to do. Then I started my own practice in 2018, focusing on functional medicine. And when I had this shoulder issue, my own self, I had a torn labrum with some rotator cuff issues as a result of that as well. I was told by my orthopedic surgeon that I should go do PT. So I did that and failed that. 6 months later was no better. And I worked really hard. I did everything the physical therapist said. So did a steroid injection in my shoulder. Didn't really get that much benefit from that, or really any benefit. And so then I came back to the orthopedist and he said, well, it sounds like you're really going to need surgery to repair this torn labrum and maybe a couple of the rotator. There's, an issue with the rotator cuff, one of the muscles there too. And I said, no, thank you. I cannot be out of work for 6 weeks. It scares me to go under anesthesia, to have you cut me open. There's no guarantee that this is even going to work. And I'm going to have my arm in a sling, not able to take care of my family or my patients for a minimum of 6 weeks. So as a functional medicine provider, I know the body can heal itself. So I knew there had to be another way. And so that's what got me started looking into this. I actually got stem cells in my shoulder a couple of years ago. And before that, I could not move my arm like this at all without like a crying reaction. Now I can move my shoulder all over however I want. So I'm, yeah, 95% better. I can go rock climbing with my husband on our dates again. And I can hug my kids without worrying about them knocking me in the wrong way. So I am just thrilled how well I did. And I wanted to offer that kind of relief to my patients too. If you have questions at any time during this, I would love it if you would put them in the chat, because I do have time set aside near the end that I'll be going over any questions that you have and answering them. And if we run out of time for the questions, my hope is that I can take a tally of all the questions and maybe do some Instagram posts on that after, because I definitely want to make sure that I address your questions. So our body has this hidden repair system. Like I said, I faced shoulder pain was told that surgery was my only option. I knew that wasn't quite right. And I also knew that traditional treatments like the steroid injections or the medications mask symptoms. They don't fix anything. They are not healing the tissue. And so that leads to just ongoing pain and dysfunction. Our body has this system in place we were created with that it can heal itself. However, when that inflammation is going on for too long, so for example, you have arthritis in your knee, there's inflammation that happens as part of that osteoarthritis or even rheumatoid arthritis, and the breakdown that happens. And so, when there's inflammation that's lasting in that joint for too long, the body's repair system can't keep up with that. And so, the tissue keeps degrading and the inflammation kind of takes over. So, what we want to do is reset that system so that the inflammation is quelled or quieted and the body can start to heal itself again. With regenerative injections, as compared with, say, steroid injections, those stem cells or even sometimes PRP can reset the environment inside that joint or inside the tissue, ligament, of whatever we're injecting, whatever the target tissue is. It resets the inflammation response in there, resets the immune response in there, and also brings cells that are going to act as signaling molecules to really boost your own body's production and recruitment of stem cells so that you get actual tissue healing happening. So let's talk a little bit about conventional treatments, because many of you probably either have looked into these, been offered them, maybe you've tried them, and they haven't worked. So I always want to say there is an option to do nothing, right? And for a long time, that was my strategy with this. I did PT, I did the steroid injections, and I waited for a little while thinking, well, maybe it will get better on its own. And of course, it didn't. Typically, if you do nothing, if it's a problem of a degeneration of the tissue, kind of a wearing away of the tissue, if it's been going on for probably longer than 6 weeks or so, doing nothing doesn't cost you anything immediately, but long term it probably does, because the tissue, it's just going to keep, it's either going to stay the same or get worse. Pain will persist, inflammation continues. Inflammation, we know, causes tissue damage. And that just leads you down the path of a worse problem later on if you don't address it. Another option would be pain medications. And earlier in my career, I prescribed them all. Duration of relief, maybe hours, right, to sometimes days if you get, say, an injection into your spine, right, or into the joint. But it is temporary relief. And there are definitely side effects. I saw it all the time: constipation, sex hormones getting completely out of whack. You wouldn't believe how many men I saw with just low testosterone, no motivation, no sex drive, just feeling really terrible. So their pain was relieved as long as they took the medication, but their life really was not a vibrant life. And of course, with pain medications, there's no tissue repair that happens with that. Pain medications really are a Band-Aid solution. A Band-Aid solution that sometimes is necessary, but it doesn't cause healing, no repair. Another option, steroid injections, right? You've heard of, probably friends of yours or you have had steroid injections for maybe arthritis in your knee or frozen shoulder. And the relief can last anywhere from weeks to months. So it's short-term inflammation reduction. Occasionally, one steroid injection can set things straight, but again, it doesn't cause tissue healing. And in fact, over time, with repeated injections, it can cause further degradation or worsening of the tissue. And what does that lead to? Well, if your tissue is degrading in your shoulder or in your knee, you're looking at a joint replacement down the line. So, and usually repeated shots are needed because it doesn't solve the problem. Other option, of course, is surgery. And again, many of you may have either gone through this or been offered this. Maybe you were a little scared of surgery like I was. The duration of relief will vary, right? Kind of depending on the nature of the surgery, the injury. It's best for severe tendon or ligament tears. If the ligament tendon has torn right off the bone, like I've seen this with bicep tendons before, it's just torn straight off the bone and it is inches away from where it needed to be, a stem cell injection is not the first treatment for that. You do need surgery for that. But a lot of times I see that people are jumping to surgery too quickly and they're not aware, probably, or educated on the regenerative treatments that are available to them. There's, of course, risks of anesthesia, the intubation, the medications, the drugs that they have to give to put you under. It's invasive, of course, long recoveries. Typically, you're off work. What is that costing you to be off work? And then you'll be on pain meds for a period of time afterwards, and there's no guarantee of success. The success rates on a lot of these surgeries are not what you would think. And then there's regenerative therapy, which is, of course, what we're here to talk about today. My favorite for many cases. The duration of relief is really the rest of your life because we've repaired the tissue. So if there's arthritis in the knee and we give stem cells, or a combination of stem cells and PRP, or maybe we're using peptides as well, that causes the healing of the tissue. So that's lasting relief because we've fixed the problem. This stimulates healing. It uses immune privileged tissues, and we'll talk a little bit about that too in the safety piece. But a little preview of that is we use cells and fluids from amniotic fluid and from the umbilical cord of born babies who go home with their parents. And those are the tissues that are most potent and highest in the youngest and most powerful stem cells. So injecting those in really signals for healing better than your own fat cells or bone marrow cells that you may hear about with stem cells. The relief develops gradually. Typically, there's an immediate relief because the inflammation goes down as a result of injecting these stem cell products. And then sometimes there's a little bit of a worsening, although not always, as that initial inflammation wears off. And then we get the tissue healing over the course of most powerfully over about 2 to 3 months, but then they continue to work for 6 to 12 months. So the duration is really long. So again, we can look at doing nothing, pain persists, tissues worsen. We can look at pain medications, giving temporary relief, steroid injections, which are short term. You have to do them over and over and they cause your tissue to degenerate. And then surgery, which is, of course, invasive, long recovery. We don't really know if it will work for sure in an individual case. And then regenerative therapy, it does stimulate long-lasting healing because we're solving the problem. This is truly functional medicine, getting to the root of the problem with minimal, if any, side effects. So that's my favorite option when it's appropriate. So how do these regenerative injections work? Well, we start out with Wharton's jelly. Wharton's jelly is what the umbilical cord is made up of. So if you've ever, been a dad and you've cut the cord of the baby, or you've seen maybe pictures, it's a really spongy but also very, very strong tissue. Imagine the baby's got to be fed with that reliably through the whole pregnancy. And so it has all kinds of growth factors in it, all kinds of stem cells, structure, so like things like collagen and other scaffolding to rebuild tissue. And then we've got the exosomes as well. And the stem cells actually that we inject and the exosomes that are in there as well are signalers. And so these signal growth factors, these signal for your own body stem cells to come in and repair the tissue, so activating your own stem cells. And then those stem cells, your own stem cells, are what actually cause that tissue regeneration. So one myth that I hear all the time, and some providers who are doing these injections are actually perpetuating this myth, is that the stem cells we inject are the cells turning into your cartilage in your knee. That's not actually how it works. We inject them, your body receives the signal, and your body then does the work of the tissue regeneration much more powerfully than it would or could prior to the injections. So what are some of the benefits? You do get significant pain relief, and that's because these injections work in at least 3 different ways. One is anti-inflammation. One is modulating the immune milieu or environment within the area that we injected. And then 3 is it does cause regeneration of the tissue. So if you can imagine if you have, significant arthritis where the cartilage is thinning and your kind of bones are rubbing together, so to speak. If we repair that tissue, now your cartilage is nice and supple and your joint can glide without pain again. You get better mobility. So you can't get down on the floor right now, maybe with your knee arthritis, or you can't golf with your shoulder issues or play tennis with tennis elbow. We can treat tennis elbow with these things. You can become active and stay active with your family without pain and injury anymore. And essentially what we're looking for is get back to your life. You know what you want to be doing and what you can't do right now because of the pain or the inability to function. So really what this is about is getting you back to like fixing your body so you can get back to living the life you want to live. So here's kind of an example timeline. I talked about this a little bit already, but sometimes it helps to see it in picture form. So about a 6 to 12 month healing timeline. Now, as I said, initially you'll see this really nice steep curve of pain relief. So we have a high level of pain down here on the y-axis, getting lower, right? And so you can see over the months, there's increasing pain relief or decreasing pain level as we go on. And then it really continues for that 6 to 12 months. And hopefully after that time, you don't have to deal with it again. Now, of course, if you are continuing to play tennis and aggravate your arm that way, sometimes things can recur, right? What I typically do with my patients is I like to understand the whole picture so that if there's a need for like a rebalancing or physical therapy to retrain how you're moving so that this doesn't recur, and we can just give the stem cell injections, regenerative injections, whatever your process might be, so that and then we can prevent the degeneration again, because you have this problem for a reason. So let's fix the tissue, but then let's also address the issue so that we can prevent that tissue from degrading again. So just a few patient stories that stand out to me and hopefully are I let you identify with these people. So this was a younger guy, late 30s, former high-level athlete, had multiple knee surgeries. I'm picturing him in my face right in my head right now. We gave him a Wharton's jelly injection to his knee. He had arthritis. He really wanted to run a half marathon 6 weeks after I saw him. Now, we talked about that and the wisdom of that. You really wanted to do that. And we talked a little bit about taking it easy after these injections. I was a little worried because he was pretty gung-ho in his training and really wanted to do this thing. So I texted him after his half marathon and I kind of tentatively said, how did it go? How are you doing? And he's like, I did great. He didn't train super hard before because he knew I had told him to take it a little easy, but he did great. He ran that half marathon pain-free and let me know he was able to get down on the floor again, playing with his kids with no pain. So he was thrilled, and actually, I'm probably going to inject another joint on him pretty soon. That's how happy he was with his results. And these pictures are not actually my patients. These are just examples. I can't, for privacy reasons, tell you who they actually are. So this patient, late 50s, mid to late 50s, came into me really hobbling, was using a cane because she had really bad Achilles tendonitis and spurs on her heel and had tried shockwave therapy, had tried steroid injections, had gone through all sorts of PT and acupuncture, a few other things she had tried to, and really just, it had helped a little bit, but obviously she was still in pain and somewhat disabled. She was using a cane to get around in her, early to mid 50s, way too young. So we did a little Wharton's jelly, little BPC, and actually I believe we only did one, maybe two injections actually on her. And within a couple weeks, she was walking without her cane. The next time she came in, a slight limp, if any, on her bad days. She said especially, but for the most part, totally walking without the cane, and for the most part was without any pain or inhibition of her function at all. So totally thrilled with that. And she remains a patient of mine to this day. All right. Oh yeah, I know who this is. So I want to give you the accurate story. So this patient I saw for a knee injection. He was really into martial arts. I believe jujitsu is what it was. Had arthritis in his knee. It was really clicking. And of course, the surgeon said, yeah, mid 50s, looking the cartilage the way it's looking. Yeah, you're probably looking at a joint replacement. So just prepare for that. Well, he didn't want to do that, of course. And so we did knee injections on him. We did a series of three. So we did a PRP 3 weeks later, another PRP 3 weeks later, the Wharton's jelly to really hit it hard with the regenerative power. And he had, again, wonderful results to improve range of motion. He was back in the martial arts dojo training again. Of course, that's really intense getting on the floor and your body's getting contorted in all sorts of different ways. And this was year and a half ago, still has not needed surgery. So that's really awesome. There's another patient I did recently that I want to quickly tell you about too. It's a little bit of a different situation with neuropathy or nerve pain or numbness in the feet. This patient didn't know why. He'd been all over trying to figure out why was he having this neuropathy kind of in his toes, on the top of the feet. It was bothersome. It wasn't painful, but every time he put on socks or shoes, it didn't feel right. And so it was just there and bothersome. And even more bothersome, we didn't know what was causing it. He went to neurologists and all of that, couldn't figure it out. So we did PRP, 3 separate injections. After the first injection, I saw him for the second one. And at that time, the issue, the kind of numbness, tingling, he said was about 70% better. So after 1 injection. And then at the third visit, when I saw him, we gained another 20 or so percent improvement. So really, really meaningful results in these people's lives. So let's address some of the concerns that I know that I hear quite a bit. Let's see. Oh, yeah. Is it safe? Well, that's a very good question. So yes, it is safe. These are immune privileged tissues, and they're coming from mothers who are highly, highly screened. In fact, the lab that I use tests not only according to the FDA standards, but much, much beyond FDA standards. And they also actually test for COVID antibodies and COVID spike protein in there. They have very rigorous screening for if a patient is allowed to donate based on their immunization status, based on their infection and past infection status. So yes, these are very, very safe, certainly safer than pain medications, than surgery, arguably safer than cortisone injections. So yes, and you want to be careful who you get these from because safety does depend on where you get these products from. So getting it from a provider, me, who's getting them from a reputable, well-regarded lab, the FDA has not written up, and that's public information, you can look that up, is really important for your safety and also for the efficacy. You're paying a lot of money in some cases for these injections. You want to make sure they're safe and that they're effective. Does it really work? Oh, what a great question. Yeah, that's important to know, isn't it? So yes, healing gradually happens. The initial phase of anti-inflammation usually is at least a few days to a week or two. And then the really meaningful improvements because tissue is building, right? It's like this factory happening in your joint over those few months that builds up. And so oftentimes people at 1 month go, oh, I think I am feeling better. And they kind of doubt it because they're a little skeptical, even though they knew this was going to work. They're a little skeptical. And then at 3 months, they go, yeah, I think it's working. But then I'll start asking them, well, are you able to do this and this and this? And they're like, oh, yeah. I guess I can. And, before the injections, I definitely couldn't do that. So it kind of sneaks up on you. The healing kind of sneaks up on you, but the healing continues to happen for 6 to 12 months. We are injecting these signaling molecules that are really awakening your own body's repair system, which is the ideal way to heal. Then I want to be clear, the results are realistic. They're not magic. And, sometimes it can seem like close to magic. But the reason that we get such good results in part is I really choose carefully the protocol that I recommend for each patient. I want to know what's going on. I want to know about that patient. I want to see the imaging in some cases if there's been imaging done or we can order it. But I really customize for each patient. I want to do the most, the best treatment for each patient because it doesn't feel good for me either if I've injected a patient and charged them for that and then they don't get results. That feels terrible to me. So I always want to make sure I'm giving the best recommendation and customized treatment. So why hasn't my doctor told me about this? Well, that's a great question. There are a lot of different reasons for that. In conventional medicine, they are typically focused on what is covered by insurance, what is kind of the standard of care. And stem cell therapy, regenerative therapy is newer than surgery, than cortisone injections and pain medications. And so it takes an average of about 10 to 20 years by the time something is researched to actually incorporate into practice. There's also not insurance codes for these things. And most of your orthopedic practices, primary care practices are insurance based. And so if there's not a number to go along with the treatment, they almost don't know what to do with that. They don't know how to bill for it. And then they're just not specialists. This is not taught in medical school. So I, for example, had to go for lots of continuing education and seek this out on my own in order to become a specialist and an expert in this. So how is Nourish different, right? Why should you trust me to do these for you? So our protocols are personalized. Like I had just mentioned, each patient receives an individualized, thoughtful plan of care, whether that involves peptides or PRP, Morton's jelly, exosomes. We can do any combination, and depending on the case, my recommendation is going to be a little bit different. And then, yeah, we use peptides for enhancement. You may have heard of some of these peptides, BPC-157, TB500, TB4, GHKCU is another one that we can use. Sometimes a trio of those peptides, that's often referred to as the GLOW combination. And those really can accelerate and enhance recovery. And one nice thing is that even after I give the injection in the office into the joint, I can even send patients home with their own vial of certain peptides to just inject under the skin for the next month or so to really boost and enhance that healing. Um, and then the healing does continue, of course, for 6 to 12 months. We want to set realistic expectations. So again, this is not magic and you'll be fine next week. You may feel much, much better, but the tissue regeneration does take a little bit of time. Again, safety first with us. I refuse to use any labs that are not strictly meeting and exceeding the FDA's compliance for sterility and quality, and then even the COVID spike proteins. I want to make sure they're looking at that too, because that's important. And then a big piece of what we do is the functional medicine integration. So this regenerative medicine is a big piece of what I do and what I love. But the functional medicine really looks at how can we support the body at a foundational level. Nutrition, hormones, sleep, stress optimization, all of those things really are important for your body's healing. If your nutrition is not on point, if you're eating garbage and you're not getting good protein, good fat, healthy carbs, your body is not going to be equipped to do this healing. And of course, the last thing that I completely forgot to put on this slide is that we make house calls. I forgot to put it on there because this is just a part of what I do. It's very normal to me. So that can be a really nice thing, especially for somebody who is tight on time. I come to you, I inject you, I go, and you can get back to your day, on your next Zoom meeting, or, you know, wake up the kids from their nap. And if you're within about a 8 to 10 mile radius of Westmont, where I am located, I can see you in your home or in your office or really anywhere. Probably not a Starbucks, probably don't want to inject in public like that, but I can really meet you anywhere. Or I do have an office in Downers Grove where I see patients as well. So let's see if we have some questions. Okay, so let me hop on here. All right, so, well, hang on. While I'm pulling this up, let me see. I want to get you thinking, right? Because you're probably here because you have joint pain or like a tendonitis or back pain, something like that. So let's get thinking a little bit about the value of being be pain-free, right? My husband, bless him, no hair. He often says, I would give my pinky toe if I could have a full head of hair. And so, what is the value of being pain-free, of being able to function, getting back to your activities again, going on vacation and being able to hike up that mountain? Or, like my husband and I do, go rock climbing, indoor rock climbing. It's very safe. On dates sometimes. What is that worth to you? And how are you suffering right now? And then on the flip side of that, what is the pain or lack of function costing you? Are you able to enjoy your daily life? Are you able to work? Are you able to volunteer? Are you able to play with your kids and grandkids the way you want to? Can you go down the slide with them at the park? Can you play, tennis or pickleball or golf like you want to? So think about what this pain and lack of function is costing you. And then, a big question that I get, of course, is pricing, right? And that is a valid and very good question. So I want to talk a little bit too about pricing before I get to some of your questions, because I want to be very open about this. It shouldn't be a secret, right? How much this stuff is an investment, right, in your health. So it shouldn't be a secret. So it's very individualized, of course, because like I talked about, packages really vary depending on the patient and the situation that they're in. I'll give you one example. If you're a real mess, right? Sorry to put it that way, but I see a lot of patients who are a real mess. Inflammation all over, maybe a couple of joints that are an issue. We want to give you the best, most effective, all-encompassing treatment that we can. So for example, we might do IV stem cells plus 2 PRPs, so 3 weeks apart, and then a Wharton's jelly to really hit it hard 3 weeks later. And then maybe we do BPC as well. The whole shebang like that would cost $12,000. So not everyone will need this though. Not everyone is as big a mess, right? So that would be the whole thing. Another example, you have one joint, say a knee is arthritic or a shoulder has a labral tear or rotator cuff tear, and maybe you just need a couple PRP, two PRP injections and a Wharton's jelly injection into that joint. We'd stage it like about 3 weeks apart. That's $4,000. So we charge a lot less than a lot of other clinics are charging. For a very simple case, we could potentially get away with one injection of Wharton's jelly, $2,500. So just so you kind of have an idea of the cost on these things. So when I meet with you for a consultation, I'll get a better idea of what you actually need, talk about your individual needs, and then I'll make a final recommendation to you. And of course, it's up to you. Usually, I'll give a couple of options for somebody, like your highest, kind of best all in recommendation, medium recommendation, and kind of like a bare bones here. I know this will help you, but it's not, the whole kit and caboodle. So that's kind of the investment or cost discussion. I also get asked a lot, how many cells are you injecting? People are trying to compare, right? And so I'll just tell you, it's 80 million for most joints. For a big joint like a hip, sometimes we might inject more. And then for an IV with exosomes and everything like that, that's 180 billion with a B cells. Insurance coverage is a question too. Yep, I see this one. It is not covered by insurance. And so that is unfortunate in some ways, although if it was covered by insurance, insurance would have control over who got it and who didn't. This way you have control over it and I have control over who gets it. They just don't have the codes yet to cover these things. So for now, it is cash based. You can use HSA, FSA to pay for these treatments. We talked a little bit about where these products come from. People always want to know, are these from aborted babies? No, 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 they are not. They come from umbilical cord tissue, amniotic tissue of healthy babies who go home with their parents. And like I talked about earlier, the FDA standards are well exceeded with the lab that I use for my products, and they're even testing for COVID spike protein and looking at infection and vaccination status. All right, next question. Who does this work best on? Okay, so people who've tried other treatments who it hasn't really worked on, so your steroids or even surgery or pain medications aren't working, patients who want to avoid these other treatments, even if they haven't tried them yet, they just know, like surgery makes me too nervous, I just don't want to do that. It's going to work best in patients who are eating healthy, generally avoiding alcohol, avoiding processed foods, that kind of thing. And then I'd like to answer the opposite question is who shouldn't get these injections? And there are a couple situations. Certainly, if you have active cancer, we don't want to inject you until that cancer is cleared and treated and you're on the mend. If it's truly a surgical situation, that would be another case where I would not recommend spending your money on regenerative medicine until, that bicep is reconnected to the bone, for example. And then people who aren't willing to live at least a relatively healthy lifestyle for a few weeks, it's almost like I hate to see those stem cells not reach their full potential if you're eating junk or drinking a ton of alcohol. And then the last case would be like a patient who can't take it easy for at least a few weeks. So like a baggage handler at the airport, or like if you're a carpenter and all on your knees, all day. So those would be a couple more. Let me see if I can go through and look at a couple more questions here. I hope I'm still sharing my screen here well. You guys are following along. Tarsal tunnel, foot pain, foot ankle. Yep, we can do that. And actually that may be somewhat similar to the ankle injections that I had told you about. What I did with that neuropathy patient is basically do a whole ankle block around, and that really worked well. So yes, that kind of pain is really treated well. Foot pain, I see a question about. It depends on the foot pain. We do have really good results with plantar fasciitis. That's a typical kind of foot pain issue that we're having, that we're seeing really good success with. So PRP, but definitely stem cells there. And then of course we want to look if there are bone spurs. We'd want to consider if it's worth looking at treatment for those before, during, or after the regenerative treatments. I see a couple questions about cost. I'm guessing those came in before I talked about cost. Financial plan to pay for the treatments. We don't. It's interesting because it's very hard to find companies that will allow this for the regenerative treatments. So for now, credit card, we accept Zelle, Venmo. You can pay in cash, you can pay check. And again, you can pay with your HSA or FSA as well. And then we can provide CPT and diagnosis codes. I do that all the time for my functional medicine visits, and then it's up to the patient to submit and get reimbursed. And very often there is some reimbursement that happens there. Let's see, let me get back to my slides here. There they are. Hopefully you're seeing what I'm seeing again. All right. And if there are any questions too that of course, you've kind of been inundated with a lot of information now, and oftentimes there are questions. Feel free to either, even post it on our social media. I check that. I check that. I'm on there. So now that you know about the science, the details, let's talk a little bit about, getting into it. How can you start this pain relief, right? So what I'm going to do now, and give me a second, is I'm going to share the booking link in our chat. And I will share here. There we go. There it is. Okay. So let me get back here. So as part of kind of a thank you for spending this time with us today, we have a couple of kind of perks for you. Normally, we do our discovery call first to kind of see if somebody is a good candidate. And oftentimes my discussion includes a lot of this. So what we're going to let our webinar participants do, because you already have this information, is skip the line. And so we're going to let you guys just book a 30-minute consult. Normally we charge for that consult, but again, I'm grateful to you guys for spending your time here with me. And so we're actually offering this 30-minute consult for free. And at that consult, I will look at any imaging that you've had done. We can talk about what the recommendation would be, what costs would be for you. I always want to talk about all those things before a patient will make their decision about what to do. If the link is not working for you for any reason, don't worry, there is a QR code coming up on one of my next slides as well that you could even scan. And of course, we'll have our contact information too on one of the last slides. So if you have any issues or questions, you know where to reach us. With the webinar, since you've attended this, if you book within 3 days, book your 30-minute consult. I may not see you within 3 days, but if you book it within 3 days, I'm going to give you a free bottle of this really potent stem cell booster. It's an oral supplement, so a few capsules. And what I like to have patients do, and again, this is kind of like an above and beyond thing that patients can do, and I'll often recommend it, is take the supplement for even maybe like a month or so after the injections, and it really just makes the injections that much more potent. It has kind of a blend of natural ingredients in it. I actually took this when I got my stem cells in my shoulder, so I don't know how much of a role it played, but I was unwilling to risk without it. So I really think this works well and see really good results with it. Vitamin D is a small part of the ingredient. We have a very specific probiotic that helps trigger stem cell activity. There's this ellagic acid from pomegranates and berries that really helps actually protect your stem cells with some good antioxidant support. And then a beta-1,3-glucan, which is like a yeast derivative that it really enhances the immune signals, encourages stem cell release. And then really all together, these ingredients are very synergistic and really just help the body's repair system, support your own natural repair system by boosting the stem cells and the stem cell mobilization in the body. So, and the benefits that you'll see. So I've told you about the ingredients and you're like, what in the world do those do? Okay, well, faster pain relief, more powerful healing, and you can get back to your activities quicker. So you'll get that at your injection appointment. And then you can feel better. You do have options. Regenerative medicine is certainly not the only option. I think it's one of the best options for most people. And remember, you could do nothing. You could do the steroid injection, surgery, pain pills, and all of those have benefits and drawbacks. I would much rather offer my patients something with real long-term healing. That's why I chose that for myself. And that's what I would want for my patients, people that I care about. So let me show you here. This is our contact information, and this is a QR code that you can scan to get your free 30-minute consult with me. And I want to recap a little bit while I leave this page up for you guys to scan or to write down the information or screenshot. The healing that we're offering with the regenerative treatment, whether it's stem cells or any of the other kind of adjuncts that we use, really helps get at the root cause. And so it heals your body, lasting pain relief, and it really restores function and ultimately getting you back to living a pain-free life the way you want with your kids, with your grandkids, with your spouse, with whoever. And so what would that look like for you? I asked you before, what is the cost? What is it costing you? And what is it worth to you? But what does it look like to you? Imagine you're pain-free. Imagine you can walk pain-free again or golf pain-free again. Maybe it's pickleball. Pickleball is very popular in our area. What would that look like for you? And then I want to make sure you know, so I see patients of all kinds all day long. So I do have some slots that I have set aside for these free consults. I don't have endless time for it. So if you're interested in this, I would really recommend booking this soon so you can get a sooner time with me and get this ball rolling so you can get back to living your best life. And then make sure that you book within that 3 days so that you can get your stem cell booster product when we do your injections. Remember, we usually charge for this visit, so make sure you, yeah, book within the next 3 days so you can take advantage of the free consult as well. If you can't find a time on the scheduler, sometimes, I don't know how many people are going to be wanting this, right? I hope a lot of you are going to take advantage of this and get better. But if you can't find a time, ideally within the next week or two, even, just make sure you text us or email us. And sometimes there are slots in my schedule that I can see that my online scheduler doesn't see. So just let us know. We'd be happy to get you in and I'll do what I can to get you in sooner. So really appreciate you guys joining me for this today. I hope this was a useful way to spend your time, and I've given you some information that you didn't have before, and also some hope that you didn't have before for whatever is going on. So I'm looking forward to talking with you for our free consult. And again, you know how to reach me. So yeah, I look very much forward to meeting you guys. Take care.